All right, back for video number 5. Using the headphones again, just to, because I don't want no problems with the audio. I'll probably fix it tomorrow, so I don't have to keep using them. All right, let's get started. Video number 5, this is prone positioning, um, by Kyle Ortega. So with prone positioning, rationales, improved ventilation, perfusion, improved ventilation, perfusion matching, alveolar recruitment, and then decreased ventilation-induced lung injury. Some indications: severe hypoxemia, ventilation perfusion mismatch, and then persistent hypoxemia despite conventional um, ventilation. All right, some contraindications are going to include fractures, especially around the spine, very unstable, increased ICP, unstable hemodynamics, any recent abdominal surgery or complication, facial airway trauma, pregnancy, and then severe cardiovascular instability. So before we prone, we're not some pre-turn considerations. Like I said, the hemodynamic stability is a big one. Secure placement of ET tubes and lines, making sure our patient is medicated. We don't want them awake or moving during this, so we're gonna have them pretty sedated and relaxed. Um, make equipment readiness. With pillows, pads. Um, getting good grips around the sheets and everything. And just stopping the drips needed to stop while we prone. Communication and team coordination, I would say, is the biggest when it comes to proning, the biggest consideration. It's not, excuse me, my voice. It's not just you and the nurse. There's a lot of people in there, and so it's got to be very organized. Our ro- our role, mostly airway management, ventilator adjustment, just and monitoring their oxygenation, and again collaborating with everybody else in the room to help prone, and then documenting. But we want to just make sure that tubes in place, they're getting oxygen. I found this checklist online. It's called a safe prone checklist. So from left to right, like pre-maneuver, during the proning, and then post. Starting with pre, we want to stop whatever drips needed to stop. If you got to move some pillows, pads around, if there's any immediate care that needs to be done before proning, that can't be done in the prone position. And then, of course, us mon monitoring our airways, and then making sure they're nice and sleepy, sleepy. And then during uh during the proning, it really doesn't go into detail of the actual proning right here. So, pretty much gonna wrap the patient in a burrito, and everybody's gonna go on a count. And first we move towards the ventilator, and then we flip them over. And it's a lot of moving parts. Somebody securing the head, the tube. Um, so during, just want to make sure the bed, everything copacetic. You don't want no, you don't want no problems while you're actually proning. And then down there, says attention, no X-ray in the prone, which sounds like a common sense. And then after proning, if you need to put some drips back on, medications, we're gonna check tubes. Uh, oh yeah, while we're proning, we're definitely gonna hyperoxygenate. Um, But yeah, after we get done, monitor the patient for any discomfort, anything, make sure the limbs, head, neck area secure and pretty comfortable. At the bottom here, just basically going a lot of team organization stuff. It talks about the physician. I've seen it done with and without the physician. Basically, just a lot of people in there. Over here, you could jot down, which we got to do in a chart anyways, but jotting down the your all your different blood gases you've got. I like this down here, this check load, just about all the pressures from supine, to the prone, time coded, so you can kind of monitor and kind of see, are we improving, are we not improving, and go from there, and talk to the doctor and stay, like I said, that constant communication. Oh man. All right, this is the rotoprone bed. Um, Pretty much a lot of the same stuff we do regular proning wise. We're gonna do um, some of the same techniques. Obviously, we're not actually doing the manual labor of it. So here, assessment, preparation, airway management. Secure the tube, uh, secure the patient. We're gonna strap them in nice and tight. You want them in the center of that rotoprone bed, and then you're gonna initiate the rotation. Securing the lines and everything as well. You get them get them rotated into the prone, monitor and adjust as needed. Make sure their oxygenation still copacetic, all the vital signs, everything. You just keep monitoring, adjust some things if you need to. Like I said, the biggest thing, collaboration and ongoing care. I'm just going to keep assessing, keep evaluating, and then you're going to document everything. All right, so how to assess the response to proning? You're gonna, evaluate, see if there's any improvements in oxygenation, lung mechanics. You're definitely gonna keep moving and reposition padding and pillows and stuff just to watch for pressure sores, especially in the head and neck area. A lot of times I've seen people on a schedule, like they'll write on the glass, like every Q4, move head to left, and just how we move, just like how we move the tube. Um, so I see a lot of that. Rotate, reposition limbs regularly. I mean, common sense. You don't want anything dangling off the bed or anything that's funny looking. No hyperextended joints and joints and limbs. And then just monitor patient for discomfort. And very key thing is being mindful that AT tube and aligns the whole time. Make sure it's secure and they're getting their oxygen. Um, like I said, the biggest thing with proning to me is collaborating with everybody on the same page, everybody helping each other out, with drips. Because a lot of times patients that are proning, getting prone, they have a lot of lines going here, there, everywhere. So it's a lot to get those out from under the sheets and everything. And then you're just going to document care and changes. So that's it on proning. My next video will be um stop sharing. There we go. Sorry. My next video will be me proning one of my classmates, Nicholas. So look forward to that. Thank you.